All right. Looks like we're going live here. Just give a minute for people to join. Man, today's an exciting day. Hope you can hear me. Appreciate everyone joining today. It is the first day of annual enrollment. Well, it's not technically the first day of annual enrollment. It's actually the first day of pre-annual enrollment, which is from October 1st to October 15th. They call it pre-AEP, AEP annual enrollment period. A lot of people will call that open enrollment. Oftentimes you'll hear people say, it's open enrollment. Well, technically it's not open enrollment. It is everything that you would assume is open enrollment, but open enrollment actually happens later. It happens January to March, but right now is about to be AEP, annual election period, which is when you can make changes at the end of the year. So, excuse me. So you guys, I'm really excited because we are going to look at Medicare.gov today and see what's coming. I'm excited, but I'm also scared and nervous because I've heard a lot of things, I've seen a lot of things, and I waited. I mean, it's 10 o'clock. I'm in Las Vegas. It's 10 o'clock here in Las Vegas on the Pacific time zone, and I have been waiting all morning to pull up Medicare.gov. I haven't done it yet because I want to make sure that I give my full, real reaction to what we see there. And it was a lot. I'm getting in the shower this morning. I'm like, I've got jitters and anxiety because I know that today's the first day of pre-annual enrollment period, pre-AEP. And there's a lot to look at in Medicare.gov, and I have saved it all for us to look at together. Feel free to make comments as we go. I want to interact with you. If you have questions, if you want to put a zip code in for me to look at, then that's great. Or comment on where you are joining from, because I'd love to know who is on and who we're talking to. And we are going to be very focused on what we are doing, which is looking at Medicare.gov throughout this live event. So this live event is going to show you exactly which plans have been introduced in certain areas by pulling up Medicare.gov. Hopefully, it'll give you an idea of what you should be paying attention during this AEP. And before we dive in, I would just invite you to grab a notepad or close any extra tabs on your computer to make sure that you'll be able to stay with us and see exactly what goes on as we're going. We're going to go through the whole Medicare process to hopefully make it a little bit stress-free for you, more stress-free. My focus, as I said, is on Medicare.gov. If you've watched any of my videos, you know that Medicare.gov is a really great place to learn about plans, but sometimes it doesn't have all the information that you need. And so, as always, even though I'm showing you all the ways that you can do this for yourself on Medicare.gov, I recommend that you work with a licensed insurance agent, either one locally in your area or someone from PlanFit, someone who really understands all of the nuance of Medicare plans, because it's not as simple as just looking at plans. If it were that simple as just pulling up the plans on Medicare.gov, then that would be great. But that doesn't tell you about providers. It doesn't tell you about some of the nuances of how to use the plan and what the different specifics are around prior authorizations and things like that. But again, those are my disclaimers. And then at the end, stick around because we'll have a Q&A, and you're welcome to ask questions, of course, anytime. If you just make a comment, wherever you're watching, whether it's on YouTube or Instagram, Facebook, wherever, if you comment, then I receive that here, and I can give back to you, answers to your questions. Marcia from New Hampshire, welcome. You couldn't be much farther away from me than that. I'm all the way on the West Coast. You're all the way on the East Coast. But I love New Hampshire. I've been there, visited the bricks, the beautiful houses on the shore there. Amazing. What a beautiful place that you live in. So lucky you. And Tim from Nashville. Hey, welcome, Tim. Love Nashville. It's like the sister city to Las Vegas. They say that in Las Vegas we have all of the bachelor parties, and in Nashville you have all of the bachelorette parties. So thanks for joining. And Gary from Kentucky gave me some zip codes. Appreciate that. That's very helpful. If you want me to look up your zip code, then put it in make a comment, and I will use your zip code in my examples here. Gary, thanks for joining us. Plan G73. Wow, real specific. I appreciate that, Gary. And Kentucky. We also got Chris from Nashville. Two from Nashville. How about that? And Nancy Lacey from Washington. Nancy, thanks for joining us. Okay, so we are, like I said, we are at the beginning of pre-AEP. we know that there are tons of plans that are being canceled this year. In fact, we know that over 2 million people are going to be Medicare homeless. Literally 2 million people are losing their Medicare plan this year. If it's one of you, then I'm really sorry for what you're going through. You know, it's been a really crazy time this last 2 years, and there's been so much good that's happened, but it's affected things in ways that we would have forecast, but maybe those who put things like the 2,000 max out of pocket on prescription drugs, which is a great thing for us to be able to tell you that there's going to be this 2,000 max out of pocket on prescriptions, but it has a major impact if you don't increase the funding to insurance. And so that's had a major impact. Let me just run down again real fast. We got Christina from Las Vegas. Hey, one of my people from here, Las Vegas, where I live. Kathleen from Chicago. Anita from Springfield, Oregon. Thank you so much for joining. Myra, thank you for joining. Thanks for giving me a zip code. Okay, so since we know that there are 2 million people that are going to be Medicare homeless, there are going to be a lot of people that need help in finding their plan. But those 2 million people are not the only people that are going to be struggling this year. A lot of plans have been stripped of their benefits because insurance companies have been losing money. And if you're in one of these plans, you seriously need to consider changing or looking at what's available in your area. And, it's like, I don't know, it's like you've been dating someone for a long time and things keep going south. This is a bad example, but you know what? I just can't help myself sometimes. Things keep going south and you're like, oh no, I'm just going to hold on. Sometimes you need to break up. And so if you're in one of those situations where your plan just keeps going downhill, you might consider saying, hey, it's time for us to break up instead. But other times, the way things are right now, you got to look around and say, is there something worth changing to? So if your plan is not being canceled and you're losing a lot of benefits, then you may need to consider making a change. Okay, so let me tell you real quickly who I am. I'm Calvin Bagley. I am the founder of multiple agencies that help people with Medicare, Nuvo Health, the Medicare Store, and PlanFit. Today we're coming to you with PlanFit. PlanFit is our virtual team that helps people all over the nation. And I started helping people with Medicare insurance 15 years ago. This is my 16th AEP. And when I started, I was literally sitting at people in their homes, helping them across the kitchen table to choose their Medicare plan. And since then, things have grown. My company has grown. I've had so many wonderful people that are now working with me, and we have helped over 60,000 people to make a decision about their health and Medicare insurance now across all 50 states. And that started with me one-on-one with people. And what we continue to do since that day and forward is always do the right thing for people. So that's a little bit about me and why I'm sharing information today. Hopefully you have had an opportunity to follow me on social media or on YouTube, where we share a lot of information. So, okay, let's get into some stuff. I know, we've got a lot of people on here. And Marcia said mostly it's Medicare Advantage plans that are being canceled. That is true. What we're seeing is Medicare Advantage plans, many being canceled, 2 million people losing their Medicare Advantage plans, 6 million people being moved from one plan to another. So that's 8 million out of the 60 million people with a Medicare. That's becoming a very significant number of people impacted. So thank you for that, Marcia. That's true. But what we're seeing with Medicare supplements is that the prices keep going up. So the pressure is on both sides, whether Medicare supplement or Medicare Advantage. And I am very adamant that you should make a decision about what's best for you and not choose based on what other people tell you when it comes to MedSup or Med Advantage, that there's a place for both, but it really is dependent on your situation. So before I'm going to start right now, but I just want to say at any time, if you have a question here, you can ask it by commenting. You could also call my team directly. My team works with me. They know me. I know them. I train them, and they will give you the same care and compassion and concern that I would give you. And they're all good people. All of them are paid salaries, not commissions. And the reason for that is because they will be completely unbiased. The idea that an insurance agent is only going to sell you something that they get paid a commission on is a concern, right? And with my team, they will always do what's right for you. So you could call them 1-877-360-6565. 877-360-65 is the way that you could call my team directly, or you can chat with me right here. Okay, let's get started. So, all right. I'm going to share my screen here, and we are going to go right into Medicare.gov, and let's see what we find there in Medicare.gov, because, I'm not even quite sure what to expect. I haven't been in there yet this morning. I say that. I've done a lot of pre-planning for today, talked to a lot of insurance carriers, so we know kind of what to expect. So we're going to start with one of the zip codes that we've been given here. Let's see, who gave me a zip code first? Let me go up. Gary in Kentucky. He would like to know about a Plan G. We're going to mostly be looking at Medicare Advantage today, but I still, let me write down your zip code here, Gary. You gave me 41056 in Kentucky. So we're going to start with that. So let's go to Medicare.gov. If you haven't been on here, this is how you can find a lot of information about Medicare Advantage plans. You'll see that there is a note here that says, due to the government shutdown, some of the information updates may be limited or delayed. Fortunately, I think they got a lot of the 2026 information here before that. I'm going to go down and go to Find Plans Now. Now, when you go here, it's going to give you the option to either log in or to use a zip code. You can see I was using a Las Vegas zip code. I am going to change that to 41056. This is Kentucky. We'll just say Fleming, the first one that comes up there. Not sure if that is exactly where you are, Gary, but it'll be the same zip code. So I'll hit continue. Now on here, you could look at medigap policies. And Gary did ask for that, so maybe I'll come back and do that. But first, we're going to go to Medicare Advantage, because that's where the big changes are, and that's where we're opening right now in Medicare Advantage annual election period. So we're going to look at Medicare Advantage Part C, Find Plans. Now, it asks, do you get help with Medicaid, SSI, Medicare savings programs, extra help for drug costs? I'm going to say I don't get help from any of these programs, because these are specific for individual people. Now, it is very important if you're looking at information on Medicare.gov, and when you're working with us, that we know your medications, because choosing a plan is highly based on the medications that you take. That is a major, major consideration. I mean, if you look at the rising cost of healthcare, much of it is being driven by medications and how expensive medications are. So it's really critical that we do this. So, do you want to compare drug costs? Yes, we do. I made a list of 5 of the most commonly prescribed medications for people over the age of 65. And I'm going to use that list in doing this, and I'll show you how this works. So the first one is atorvastatin. So I start typing in, you can see that it pops up. I'm going to click atorvastatin and add drug. Now you need to make sure you get your dosage and quantity right. If you make a mistake here and if you change the dosage, or you put the wrong dosage, changing the dosage is fine. But if you put the wrong dosage, it's going to skew your results. You would think that the 20 milligram tablet would be covered the same as the 40 milligram tablet, but it's not, because every insurance company has a formulary, a list of medications. The formulary is the drug list, and it's not just the name of the medication. It is also the dosage and the frequency. So you have to get the dosage and frequency right. Today, I'm going to use the defaults, which are the most common, the most commonly used ones. Oh, look, they want me to do a survey. Well, I don't think I'm ready yet. I need to see what it says first, and then I'll tell you if I'm interested in giving a survey. Okay, so I'm going to add that drug. Let me add the next. I have 4 more to add really fast here. I'm going to add amlodipine, very common medication. We're going to do the standard dosage. I'm going to add metformin. Many people are taking metformin for diabetes or pre-diabetes. We're just going to go with, we'll do glipizide. That's good. So we'll add that standard. Now we'll do lisinopril. I mean, it's probably not common that someone would be taking these together, since they're mostly related to diabetes, but that's okay. And then I added the most commonly prescribed brand name medication, which is Eliquis. And so we're going to add Eliquis. And that will give us, so this is going to give us multiple levels, right? We're going to have the tier 1 generic, and we're going to have a more expensive brand name in here as well. And that will help us to get a really good picture. So you can see now I've got my drug list compiled. Now that I've done this, we'll be able to go to all the different zip codes and states, and we'll be able to see what the plans look like in those areas and use the same drug list. So I'm done adding drugs. Now, here is the next part. You're like, okay, how long does this go to get to plans? Well, if you just want to see plans, you could have skipped all this, but it doesn't count. I mean, it just isn't the same if you skip all this, because the pharmacy that you use is also important. Because if you're really set on using Walgreens or Kroger or wherever, you have to choose a plan that contracts with that pharmacy. The other thing that we often find is that sometimes a plan will have good, good copays at Walgreens. In this example, we've got Walgreens and Kroger. They might have really good costs at Walgreens and bad costs, then high costs at Kroger, because Kroger's out of network. And if you only looked at Kroger, then you wouldn't know that by switching from Kroger to Walgreens, you could save money on that plan. So it's really important to make sure you add your pharmacy and maybe add a couple of extra ones. So we're going to put in Kroger, we're going to put in Walgreens. Let's go down and put in Walmart. Okay, that gives us 3 pharmacies with different, from different companies, and gives us a really good idea. So what do we get? Well, here we are in Fleming, Kentucky. There are 36, if you see right here in the middle, 36 Medicare Advantage plans. That's quite a few. And it turns out that is not the full list. If I up here on this include special needs plan radial button, if I click on that, it's going to add more plans, because it's going to add special needs plans like people with CSNP, which is chronic condition plans. So this could be someone with heart or diabetes, heart problems, COPD, etc., depending on what's available in your area. DSNP, which is dual eligible, meaning you have Medicare and Medicaid, so low income, and ISNP, institutional plans. These are plans just for people living in facilities like nursing facilities. So now actually there are 61 plans available. And if you qualify for, let's say, a CSNP, a chronic special needs plan, then you want to make sure you've added that in there. And you notice that the top plan that comes up is the Humana Gold Chronic Kidney Disease Plan. That is the first plan that pops up. Well, if you don't have kidney disease, then you're not eligible for that plan. So for today, I just wanted to show you that, but I'm going to take that off and just go to the standard plans, the 36 standard plans, and let's just take a look at what there is here. So we start off with the Humana Gold. You see the Humana Gold Plus. You're going to see the Humana Gold all throughout the country, but it is different in every single area. This one has a 0 monthly premium. It says that your total drug premium cost for the drug list that I gave would be $748 at the pharmacy, at a retail pharmacy in 2026. So it's even forecast out and said you're going to spend $750 on medications. And that is why this plan is at the top, is because it's going to have the lowest drug and premium costs. And you'll see as we go down. This has a $250 drug deductible, a $5,450 in-network maximum out of pocket. Now, if we scroll down, the next Humana, $766 is what you'd pay for your medications for this Humana Choice PPO. And you'll see this PPO has an in and out of network maximum of $9,600 and an in-network maximum of $6,250. So it's getting a little more expensive. On the right, you can see some of the things, like it says, it's got vision, dental, hearing, transportation, fitness benefit, 0 copay for primary care doctor, 40 for specialists. So you can see just kind of a high-level overview. We go down another Humana plan, $766 in medications, the Humana USA Honor Give Back PPO. So this is an interesting one. It has it gives some money back in your Part B. So lots of Humanas here at the top, 766. The reason Humana is at the top is because Humana has the right formulary and drug costs for the medication list that I gave you. Then you start to see Devoted PPO, $768 for total cost. The AARP, that's United Healthcare Advantage Essentials, $837 for drug cost. This one, you can see on the X on the side, missing transportation. The AARP Give Back, we go down, now we see Anthem. And you see how how entering your medications is really critical. If we fast forward to maybe number 3, let's go all the way forward to the third page. It's $1,191 for medications. Now, the difference between $700 and $1,100, it's not a massive amount. If you're really happy, let's say that you're in the WellCare or Simple Open PPO, and that's the one that your doctors take, and you say, well, you know what? It's worth it to me to know that I'm going to pay $400 more because I want to have the doctors that WellCare takes. Well, at least you're going into that with eyes wide open, knowing exactly what you're paying for, right? Because what you're paying for in that case is you're paying for access to doctors that WellCare takes. Or maybe what you're paying for is you're paying for the brand. You trust and believe in the WellCare brand, right? But this way you can go in, like I said, eyes wide open, knowing what you're signed up for and why you've done it. Now, if we go all the way to the end, there's some United Healthcare, more WellCare plans. Sorry, this is probably moving really fast. A couple Anthem plans. We go all the way to the bottom, and I want to go to the final page, page number 4, and show you your worst case scenarios down here. So, if you went with the Humana USAA Honor Give Back plan, this is a USAA branded plan. USAA, the financial institution. Well, it would cost you $12,000 for your medications. You say, oh my gosh, why would it cost $12,000? Because the USAA Honor Give Back plan, just by seeing the name, USAA Veterans Honor, that usually is a name that Humana gives to plans for veterans. This is a plan designed for people with VA benefits. So if you have VA benefits, then you would join a plan like this because you're going to get your medications at the VA. And if it's your intention to always get your medications at the VA, then you don't necessarily need drug coverage. This plan doesn't have drug coverage. Instead, it may give you some other benefits, which in this case, it's the give back, which means it's going to pay part of your Medicare Part B premium. Some people are really curious about how that works. So let's go in here and let's look at the plan details and see what it says. So if we get to the plan details, it says the premium is $0. The health premium is $0. The Part B premium is $185. The Part B premium reduction is $100. This plan is paying $100 of your Part B premium. And if you sign up for a plan like this, you have no drug coverage, but your Medicare is going to be reduced to $85 a month. It takes a couple of months for it to happen, and then you would see in your Social Security that your Medicare got reduced from $185 to $85. And so that's why someone would choose a plan like this. Certainly not for most people, really just for people with VA coverage, right? But I thought it'd be interesting to see that. Let's go back to our search results now. And I want to look at one more thing before we leave Kentucky. We're on page number 1. Let's go to the, the Humana Gold Plus is a very large plan nationwide. Well, it's not a nationwide plan, but the Humana Gold Plus, they have Humana Gold Plus in many, many places. Let's just look at this plan and see what it looks like. This is the Humana Gold Plus, and you see the plan ID number H561907-0. That's the number of the plan, and in every state that number would be different. So that helps us to determine which exact plan that we're talking about. This plan would be a $0 monthly premium, 0 health, 0 drug. You still have to pay your $185. Does it pay back some? Is there a reduction in your Part B? Yes, $1. So if you join this plan, this is the kind of stuff you can't make up, man. It's hilarious. If you join this plan, you'll pay $184 for your Part B because it has a $1 reduction. People look at this and they say, why do insurance companies do this? Why do they do this? Well, I'll tell you why. There's a very complicated process when an insurance company submits a bid to Medicare to be able to have a Medicare plan and to be funded by the government. And they submit it, and then the government comes back and says, this is what you submitted, this is what everybody else submitted. Based on that, you have to make your benefits a little richer. Richer meaning you need to give more to people. And sometimes they're like, you need to give $1 per month per member more. And Humana's like, oh my gosh, how are we going to figure out $1 per month per member? Well, let's just give them a $1 Part B reduction because it'll be too hard to figure that out in the plan. And so that's how you get these odd $1 premium reductions. It has a $250 drug deductible, a $5,450 maximum out of pocket. It's kind of interesting that we're doing Kentucky because Humana is based out of Louisville. You have to tell me if I said that right. Louisville. I'm just kidding. It's based out of Louisville. And so you can see primary care doctor 0, specialist 35, diagnostic tests and procedures 0 to $105, labs. These, whenever it has a 0 to whatever, that usually has to do with the type of service and the location. So sometimes, lab services, a lot of times they'll say, well, you know what, if you do your lab service in a physician's office, it's 0. If you do it everywhere else, it's $50. So these are the kind of specifics that only an insurance agent is really going to be able to tell you because we use Medicare.gov sometimes. We have our own software. And in addition to that, we will get the plan's documents. So, I'm sure you all got your Medicare and You 2026, and you see this huge book of the Medicare and You 2026 guide. Well, every plan, Humana and all of them, have a book this big, and we go in and we study that book and we look at what it says in there, and that will give us way more than what we can find on Medicare.gov. Okay, that's some information for Kentucky. I do want to go back to the. How do I get back? We're gonna have to start back with Find Drug and Health Plans all the way at the beginning. And we're going to do one more thing. We're going to look at medigap because that's what we set out to do initially for Gary here. So if we look at the medigap plans, Gary said, let me go back here. Gary said 73 in January. So we're going to just say 73 right now. Male, do you use tobacco? I hope you don't. But so we're going to say no, and we're going to update prices. So we want to see a plan G, and here's a plan G. It says the premiums are from $154 to $590. Wow. $154 to $590 are what you can expect to see in that area. So we go to plan details. It's like, oh, here's some plan details. But you see, it's very, very little information about the actual, if we go to view policies, it goes back to, it will show us who the carriers are, the insurance companies. MedMutual, Life Shield, WellCare, Centene PDP Preferred, Bankers Fidelity Assured, WellCare Centene, Globe Life, Humana, Achieve, American Benefit Life Insurance Company. So it has all these lists of insurance companies that offer plans. Now, listen, I don't know anything about some of these insurance companies. I know very little. But what I would tell you when you're looking at Medicare supplements is to be very careful, because sometimes when you purchase the lowest cost plan, and it's not to say you shouldn't consider MedMutual. I'm not saying anything about MedMutual. I'm just talking in generalities. You should be careful about joining just the lowest cost plan, because what we see time and time again is that insurance companies with Medicare supplements will come into an area. They will offer a very, very low price, intentionally lower than, knowing that they will lose money for a short time to gather people up, and then they will raise prices. And so when you're joining an insurance company, you want to know things like, what is your history of rate increases on a Medicare supplement? Do you keep raising your rates? And if you keep raising your rates, and what has the history been, then that can help me forecast the future. And the other thing is, how recently have you come into the market? If you just opened last year or last month, then of course your costs are low, but they're going to go up over time. And the thing with a med sup is, especially in Kentucky, you're stuck if you have a health challenge. So they have a captive audience, and once they have you, then they start to raise rates. So, what is the actual cost to have a Medicare supplement, for an insurance company to have a Medicare supplement? I would say it looks to be around $190 to $200 is what is actually costing the insurance company in this area to offer a Medicare supplement. So, these lower ones, like $154, it looks like a great deal. It's not going to last. It never does. Things average out. And then if we look at the bottom and say, well, what about these ones that are super, super expensive? Well, United Healthcare is the level 2. So we're gonna leave that out. Level 2 means that this is for people who were approved, but at level 2, meaning they were approved, but they had health challenges. And so United Healthcare could put them at level 2. So maybe that's not a great example, but let's look at these, like Bankers Life, $349. This is more of what it costs to run a plan in that area. And you can expect that this $150 plan is going to turn into a $300 plan very quickly, because that's what it costs to run a plan in the area. Okay, I hope that was helpful, Gary. Let's move on and let's look at some more. Let's look at a new place. So who else did we have? Gary was the first. We had Marcia at 0. You guys, I have to write this stuff down. My brain doesn't remember numbers like this long enough. So, okay, Marcia, we're going to do yours at, I'm going to go down to Find Drug and Health Plans, and we're going to search. Oh, I know what I should have done. I'm going to do this on Marcia's 08320, 03820. And we're going to do Medicare Advantage plans, find plans. We're going to say, I don't get help with any of these programs. Our drug list is still built. So I'm moving through this a little bit faster for you. We will keep, we're going to add a CVS in there. We're going to remove these because they were from another state. Let's add Rite Aid. We got CVS, we got Walgreens, maybe throw in a Walmart. and continue with plans. Okay, so what do we have? Well, in Stratford, New Hampshire, beautiful Stratford, we have 12 Medicare Advantage plans. 12 Medicare Advantage plans is all we have. That, if we turn on the radio button, let's see what there is if we add special needs plans, 14. So you don't have nearly the number of choices in Stratford. I mean, I shouldn't even say this out loud. I feel bad for you, but in a way I kind of don't, because you live in such a beautiful place. I'm jealous of you and feel bad for you at the same time. Can I say that? Okay, so we're going to undo the special needs plans, and let's look at what we have. We have the Humana Gold Plus. This one has a $14 premium, but you notice that the full out-of-pocket cost of $734, that's not bad, actually, to cover all your medications on this plan. And it has, zero primary, $30 specialist visit, a $6,400 maximum out of pocket. So in your worst case scenario, if you hit the maximum, that's pretty high, $6,400. But it would take, when you look at these plans, it takes a lot to get there. Let's skip the Humana Choice Give Back PPO. Let's go down. We got another Humana Gold Plus. Very common, like as we're going to see the Gold Plus in a lot of places. It has a similar drug cost, similar maximum out of pocket. This is probably the more popular plan in the area, along with the AARP Medicare Advantage. They would be, you're going to see everywhere we go that United Healthcare, AARP Medicare Advantage, and Humana Gold Plus are big competitors against each other. They have very similar benefits. What else do we have in this area? We've got a United Healthcare non-AARP branded PPO with a very large maximum out of pocket and a $21. I mean, it's getting expensive at this point. Let's see what else we have. WellSense. This would be a regional plan, WellSense, with a $21 premium. It would cost $1,600 for your medications there. What's your coinsurance? 20% when you see a primary care doctor, 20% when you see a specialist. So you have to pay a percentage of your costs. And I think that's all we have. Wait, let's look at page 2 real fast. We have the Humana. So you have 3 companies in your area offering Medicare Advantage plans. You have United, Humana, and WellSense. That's all that you have to choose from. Now, this is a great opportunity now for me to go and say, let's see at the top, show me 2025 plans. Let's see what changed in Stratford. In 2025, Stratford had 27 Medicare Advantage plans, 27. So you can see a massive reduction there in Medicare Advantage plans. Let's see what they had. I'm going to turn off the special needs plans just so we get through this. They had WellSense. WellSense had very strong plans in 2025. So I'm looking at this saying, okay, people with WellSense, your plan went from $0 premium with a $4,900 maximum out of pocket, with 0 for primary care, 25 for specialists, and it got hit hard. This regional carrier, WellSense, obviously is getting hit very hard by the changes to Medicare. So we can see that they have had to really pull back. So I would imagine there are a lot of people with WellSense that are going to be concerned about that. Humana, stuff Humana. Martin's Point Generations Advantage. Did you notice that we didn't see Martin's Point in 2026? So this would indicate to me that Martin's Point is dropping their Medicare Advantage plan in Stratford. And so people with a Martin's Point plan, what are their options? Well, they have got to either move to another Medicare Advantage plan or go to a Medicare supplement plan. And when your plan drops, you have the right to join a Medicare supplement, no questions asked, regardless of what your health is. So you have a choice. Go to one of the 2026 Medicare Advantage plans or go to a Medicare supplement plan and start paying a premium. Another WellSense, Martin's Point, as we established, Martin's Point has no longer offering plans in the area. Let's see what we find on page 2 and 3. Anthem. Okay, you notice 2026, we saw no Anthem. Now in 2025, Anthem had a $26 premium, but 0 primary, 45 specialists. There may be people that were on Anthem because they needed specific doctors that only took Anthem and didn't take these other plans. They have the same situation that I just shared. They have got to go to another plan. I mean, we are finding people just by putting in zip codes that are losing their coverage in 2026. You've got United Healthcare. We got another Anthem plan, a PPO, Anthem, another HMO. Those have all gone away. And then you can see that the companies. Oh, Aetna. Did we see an Aetna plan in 2026? No. Now we found, man, Stratford is getting hit really hard. They're losing Aetna too. So the Aetna PPO was not there in 2026. Same issue. Man, this is hard for me to see. And I'm sure it's harder for people who have these plans and for what they're going through. Here's more plans, Aetna, Anthem, that are all going away. Wow, man, Stratford, I'm sorry. We know that the Pacific Northeast has been hit hard. Connecticut, New Hampshire, some of those areas have been hit very hard. And people keep asking me, why is this happening? Because it's confusing to people. Why are these plans going away? What's going on with these greedy insurance companies? I mean, if I had $1 for every time someone talked to me about greedy insurance companies, and listen, I am not here to say that greed doesn't happen. But what you're seeing when you see it on this massive scale, this isn't a one-off where you've got like one greedy corporate executive. We've seen that. We have seen greed happen. So I'm not discounting it. But what you're seeing across the United States is systemic. It's not greed, it's systemic. So what is systemically happening? Well, with the Inflation Reduction Act, we added a $2,000 maximum out-of-pocket on prescription medications and got rid of the donut hole. I mean, yay, we can all clap for that. That's amazing. It's wonderful, right? And it's great for me as an insurance agent to come to you and say, I've got great news for you. You no longer have to have the donut hole in prescriptions. But it costs money to do that. And that's the part that I have my beef with politicians, because they make promises and then they don't think about the cost, right? Or maybe they do and they just think we'll figure out a way, right? But there's a cost. When you increase benefits, there is a cost. Well, the Inflation Reduction Act increased benefits, but reduced payments to Medicare Advantage plans. So you can't do both. You can't say, now you have to give more and you're going to get less money. And when you do that, you have a systemic thing that happens. Now, lots has happened since then. And again, I love being able to say the donut hole is gone. I love being able to give better benefits to seniors, but we have to be eyes wide open. We have to understand that there's a cost. So if you don't increase the federal money that goes to an insurance company to offer that benefit, then insurance companies start losing money. Now, there's another thing that happened, which is kind of crazy that we would be here in 2026 still talking about COVID-19. I mean, it's 2026, COVID-19. Even though it was COVID-19, it was more, it happened in 2020 primarily and through 2022. So that was years ago. What does that have to do with now? Well, we are still seeing that insurance companies are having higher claims and more surgeries and everything than they had pre-COVID. So that backlog of stuff still has been coming through. Hopefully it's kind of almost through at this point in 2025. Claims happen sometimes a year in arrears. So sometimes we see all these claims right now in 2025 that may go all the way back to late 2024. And so sometimes we're looking at things that happened way in the past. And so with COVID, there's still major claims. So you've got claims pressure. We call that claims pressure. And that's what's driving up Medicare supplements. Medicare supplements in the last 3 years, on average, have gone up 10 to 15% per year. We're talking 35 to 50% increase in Medicare supplements in the past 3 years. Why? Supplements, they're not greedy insurance companies. They have no control over the money you spend. Why are they increasing their rates by 50%? Because they have to. They're still losing money trying to pay all of the claims. So and then there's one more factor. I'm sorry, I'm getting a little long-winded here, but the last factor is that the cost of healthcare continues to go up. And if you look at who's making money in healthcare, it's not insurance companies. Insurance companies are losing money, and that's why they're taking their plans away. The people making money in healthcare primarily are prescription drug companies. Prescription drug manufacturers are making record profits and having just massive amounts of money. Second to that would be hospitals in metropolitan areas, while hospitals in rural areas are struggling. Rural hospitals are losing money. Metropolitan hospitals are making record profits. And then you have provider groups and doctors and things that are still making profits, even though you would hear other complaints. So listen, I am not against any of these groups. I am just for common sense and to look at this and say, why is my insurance company messing with me? Well, because of the pressure that they're under. Increased benefits, lowered reimbursement, meaning they're getting paid less from the government. That's kind of been changed now, and hopefully that'll help to modify things for 2026 and 2027. That's kind of being smoothed out. But with the Inflation Reduction Act, reduced payments, increased benefits, increased claims, and then massive profits, increased profits to prescription drug companies. All this creates this really difficult situation. So let's go in. We're going to just go straight to changing location to look at another location. I think I've got at least one more in me here. Let's see. Myra put in 10032. 10032. Okay, let's take a look and see what we get. This is in New York. Perfect, because I had a New York zip code. I was going to do Brooklyn, but we'll do New York. That's great. New York, New York. Man, it's one of my favorites. Who doesn't love New York? It's an incredible city. 40 Medicare Advantage plans. What's our with special needs plans? 82. Okay, now you're starting to, if you go to an area like this with lots of people, I'm going to actually, after this, I'm going to do one more. I am going to do a rural area that's just getting decimated. But if you go to these major metropolitan areas, you're going to fare better than people in other areas. Places where there are lots of seniors. Think Florida, Texas, Southern California, Arizona, Nevada, meaning Las Vegas, Southern Nevada. These places with and then large cities with strong health with strong provider groups and things, and access to hospitals, places where Optum and CenterWell and all of these large provider groups are based, you will see stronger plans. So let's hope that plays out here. So 82 if you include special needs plans, 40. So there are twice as many plans if you look at special needs. So I would say, if you're in New York, as Myra as you are in New York, I would say you need to make sure, be sure that you know which plans you qualify for. If you qualify for a special needs plan, then you're going to want to take a special needs plan because they will probably be better for you. Maybe I should take just a minute and look at that for a moment. The first plan, the elder plan, is an ISNP. That's for people that are institutionalized. If you're on this, if you're watching me now, it's less likely that plan applies to you. But there are, let's see, what else? What other special needs plans am I going to find here? It looks like the regular plans actually are very strong. I'm looking for special needs plans. Well, I have to scroll way down. Maybe in New York, the special needs plan doesn't matter as much. It just depends. But if you qualify through heart, diabetes, etc., you want to make sure that you look at those special needs plans. What do we have? But before I do this, let's. Oh my goodness, you guys! I just made like a blunder. This is I'm looking at this right now, like I'm a greenie, greenie, like brand new. I'm still viewing 2025 plans. Oh my gosh. Okay, so we know what 2025 looked like. 40 Medicare Advantage plans, 42 special needs plans. Man, that's kind of embarrassing. Okay, let's go to show me the 2026 plans. Okay, it went down to 35. So there's 35 regular plans, and how many special needs plans? From 82 to 75. So, that's not terrible. We clearly are losing 5 regular plans and, 2 or 3 special needs plans. Two special needs plans? Yeah. I forgot how many there were in 2025, but we're losing some plans. That's not terrible, but clearly some plans are going away because they're not offered in 2026. So make sure we're on 2026 plans. You've got the elder plan, Flex HMO POS. People see this HMO POS and it can make a great joke. What is this POS? It doesn't mean piece of crap. HMO is a health maintenance organization. That means that you have to go to your primary care doctor, and your primary care doctor will refer you to specialists. You need to stay in network. There is no out-of-network benefit except in emergencies. In an emergency, you can go to any hospital, any urgent care, and you receive care. So it's okay when you're traveling on an HMO because when you're traveling, you're going to have emergency care and ERs, ambulance. If you're in a car accident and you're out of state, an ambulance will take you to the hospital. The hospital will treat you. It's all will be treated as if you're in network. But the POS is point of service. And what a POS does is it says, we're going to give you a small amount of money that you can use out of network. It's not a PPO. You can't go out of network wherever you want. It just has a small out of network benefit. And usually a POS gives you just enough to go get a second opinion. For example, I had a very good friend of mine that passed away of colon cancer. It was a terrible tragedy. She was a young mother. She had a 2-year-old when she passed away. And part of the reason they didn't catch the cancer is because they thought that she was just having complications from childbirth. And when they realized that it wasn't complications from childbirth, that she had cancer, it was already stage 4 and she passed away. It was such a tragedy. Well, she wanted to go when she was being treated for cancer here in Las Vegas, Nevada. She wanted to go to Texas. She wanted to go to Cancer Centers of America. She wanted to make sure that her treatment here was the very best, could save her life. And I'm sure that many of you would want the same thing. Well, that's what a POS can do. It allowed, and she at the time had a PPO, and she was under 65, obviously, with a 2-year child. But she went down to Cancer Centers of America, and they looked over everything. They did scans, and they looked over her treatment regimen and everything. And you know what they said? They said, you are being treated correctly. You are being treated in Las Vegas the same way that we would treat you here in Houston. So continue with what you're doing. That's an example of how POS works. It allows you to go and get a second opinion, to go out of network and get some advice and see a doctor and have some coverage. But in this example, though, it wouldn't cover you to be treated. It's not going to be enough money for you to go to Houston and get treated for cancer, right? But it's enough to go and test something out. So that's what the HMO POS. So it's not a POS as in a piece of crap. It's actually a pretty nice benefit to have if you're in that situation, that specific situation. So we can see the elder plan is still there. We see the Humana. By the way, the elder plan Flex HMO POS had the lowest drug and premium cost of anything we've seen so far. $564 is how much you would pay for your medications for the year. And actually, let's just look at this for a minute and just see what this plan. It's kind of cool to see regional health plans. And I would say we're calling this year Termageddon. It's like termination Armageddon for plans. 2 million people being terminated from their plan. It's Termageddon, right? I would also say it's also the year of in many cases, not across the board, but in many cases, it's the year of the regional health plan. There are many regional health plans that are up and coming, that are offering great benefits, that offer incredible service. I don't know about Elder Plan myself. It's not a company that I have worked with in the past, but it's just for me to give you an example of how there are regional health plans that are really coming alive right now under pressure. And many of them, again, I'm not talking about Elder Plan, but there are many large plans that are not for profit, and there are regional plans that are not for profit that are also doing a lot of up and coming things. So I would say that this year, maybe you have always been with a major carrier, and that's great. You may want to stay with that major carrier. Maybe you have avoided looking at the regional carriers. This might be a year where you need to look at regional carriers. But in some cases, this might be the year where you need to move from your regional carrier to your national carrier. It just depends, right? Like everything else. So let's take a look here. This has a 0 premium. You're going to pay your $185 premium. They don't have the $1 premium reduction. The health deductible 0, drug deductible $375. So you say, wait, how does it have the lowest cost if it has a $375 drug deductible? Well, we're going to take a look at that, and it'll probably show us here. 0 for primary, 0 in network, and $35 for specialist visit. You notice it says out of network 0 to 35. That's the point of service. That with your point of service, you could go to an out of network specialist using your point of service. There'll be a limit to that benefit. Medicare.gov is not going to give us enough information to determine how that works. Again, you've got to have the big book for elder care, which is what we would do. Is we would look for that and research that. But okay, emergency care. Let's get to hospital. What is it? It's a $425 per day, days 1 through 5, and then after that, you don't pay anything else. So you'd have to pay for the first 5 days in the hospital, and then you pay nothing after that. That's pretty good. Skilled nursing facility, 20 days for free, $196 a day, days 21 through 100. That's an area where you start to hit your maximum out of pocket. If you were in a skilled nursing facility for 100 days, it would start to get pricey. Another area where people hit their maximum is things like cancer, because usually with cancer, you're going to pay 20% of the cost of cancer treatments. Ambulance, preventive service, occupational therapy. Let's look at the drug costs. So this is interesting down here. We haven't gotten down here yet, so this will be something new for me to show you. Appreciate all of you who've stayed on this long, man. You are my friends at this point. And I see that there's still a lot of you, so thank you for being here. I hope this is providing value. And by the way, if you're finding this helpful and you don't follow me on social media or on YouTube, I mean, we're really making an effort right now to grow our YouTube channel and to provide real value, to tell you the truth about what's happening, and to not be tainted by Medicare supplement. If you go on YouTube, you'll see all these people that are just pushing Medicare supplements. And I believe in Medicare supplements, but I also believe in Medicare Advantage. I believe that you should have an unbiased look, and that you should just get the honest truth about this stuff and figure out what's best for you. So if you want the no spin, like, man, I say no spin, I sound like a news anchor or something. But if you want the truth, then follow me on YouTube. You can look it up, Plan Fit. Just go to Medicare Plan Fit on YouTube and follow me there if you're not already following me there. Okay, so here are your medications, the list of 5. You'll see it shows the pharmacies. With this one, you don't want to go to Rite Aid. So if you join this plan, don't go to Rite Aid. It'll cost you money. Look at amlodipine. Amlodipine at Rite Aid, full cost. Rite Aid is out of network. So this plan does not work at Rite Aid. Eliquis, it says it would cost you at Walmart $578, at Walgreens $564, at CVS $564. We can keep going down and get even more detail in this. I love this part of Medicare.gov. It's my favorite thing that they do is the drug price, the drug forecasting, because the rest of this, the health stuff, is pretty crappy. It's really not giving you the information you need. But this is really solid, how it gives you the drug costs. By the way, Medicare.gov also does a very terrible job of telling you which doctors are in network. Terrible. Okay, so let's look at Walmart. What are you going to pay at Walmart? You're going to pay 47, 61, 47, 47, 47, 47, all the way down. That's what you would pay at Walmart. It's even forecasted by month. I don't know why February has 61. That's interesting. Walgreens doesn't do that. So at Walgreens, it's 47 all the way down. So I don't know. When I see a funny number like the $61 at Walmart, I start to question, is this a mistake? Might be a mistake in the numbers, but what's clear is you don't want to go to Rite Aid. Walgreens is $47 all the way down, CVS 47 all the way down. What is this telling me? It's telling me that drug deductible, let me go up a little bit here. We have the drug deductible. Sorry, it's way up here. I'm moving really fast. It's probably going to make you dizzy on the screen. $375 drug deductible. The $375 drug deductible clearly does not apply to these medications. That would be that it's from a different tier. And I'm sure we can go down and find that as we go a little further. I'm going to make you dizzy again. I'm scrolling down to view more drug coverage. Here we go. Found it. Okay. Other drug information. There is a lot of good information here. Can't you tell this is so overwhelming? It's crazy. Tier 1, Tier 1, Tier 3, Tier 1, Tier 1. There's no prior authorization on these medications. There are quantity limits. But clearly Tier 3 must not be the $375 drug deductible. It doesn't tell me here, but if I got the plan materials, I'm sure it would tell me that Eliquis or that Tier 3 does not have a deductible, but Tier 4 probably does. So if you have a really expensive medication, you're probably going to pay the $375 drug deductible. Quantity limits. What are the quantity limits? Well, let's look at Eliquis quantity limits. It says quantity limits 74 and quantity limit frequency 30 days. So you can't get more than 74 tablets in 30 days. If you're in a situation, I can't imagine this, but if you're in a situation where your doctor is prescribing 3 a day, 3 Eliquis tablets a day, then you're going to run up against a problem on this plan because it's going to say, no, you're limited at 74. Now, how big is the problem? Not terrible. Your doctor is going to need to ask for an exception with the plan. And if he or she submits their justification, then the plan will probably accept it with proper justification almost every time. But there is going to be some back and forth there because there's a quantity limit on Eliquis, glipizide, and atorvastatin. But these are just for extreme usage situations. And you know what? I think that's really good. Some people look at these prior authorizations, quantity limits, step therapy, and say, "Oh, the insurance company is trying to stop me from getting from what my doctor said is right." Well, you know what? This may be really controversial, but let me tell you, I think that at least 1%. This is 1% of the time this is going to come into effect. Maybe 5% of the time. I don't know. Is there a place in you that could say 5% of the time the doctor could be wrong? 5% of doctors could be overprescribing? If you say it that way, you probably would say, well, you know what? probably more. There's probably more than 5% issue. Well, when an insurance company has quantity limits, it could be keeping you safe. So I don't have an issue with prior authorization and quantity limits when they're being used to keep people safe. Okay, so I promised one more. I just want to, so that was some interesting stuff from New York. We've already seen plans that have been wiped out and everything like that. And I want to change location, and I want to show you one more place where we are seeing a lot of change. 83401. This is Idaho. Now, Idaho's not far from me. I'm in the West. I'm in Las Vegas. Yeah, people don't realize that Nevada, everyone thinks of Nevada as Las Vegas. We border on Idaho because our north border is way up there. So this is our neighbor state. What's happening in Idaho? Well, let's look at 2025. In 2025, they had 20 plans available. They had the Blue Cross of Idaho plan. They had a lot of good options, like the True Blue plan, zero premium plan, etc. But they're getting hurt really bad. And I'm going to do this really fast because we're coming up on time here. But now in 2026, they have the United Medicare Advantage, thank goodness. But you look at some of these premiums, their PPO is going to $64 a month, $74 a month for an HMO POS, $87, $99. Some of these carriers have raised their rates to the point, now you have your give back plans. That's pretty much, that's most of the stuff. Some of these carriers have raised their rates to the point where sorry, I'm moving really fast here. I'm going to go back and just look at this again. If you're paying $74 for an HMO, wow, that's pretty painful. Especially when in Idaho you could probably pay $150 or $200 and have a Medicare supplement and not have out-of-pocket costs or a $5,900 maximum out of pocket. So this and we are seeing a lot of stuff that the blues went away there and things. I don't want to get into the weeds, but I mean, I do want to get in the weeds, but I don't want to go too far in Idaho. I know it doesn't affect a lot of people probably watching here, but it gives an example. If you're in a rural area, we are seeing big premiums come back in Medicare Advantage. And that's a new thing. We are not used to seeing those kinds of big premiums in Medicare Advantage. So, okay, that's a lot of Medicare.gov stuff. And wow, there's a lot there. I'm gonna take a minute and look at our comments here. I haven't been watching for a moment, just see what we have. Marsha said, you have a supplement, you've had no issues, 2 hip, 1 knee, a pacemaker, cancer, haven't paid anything. Why would I consider an Advantage plan? I have Aetna. Marsha, you've done the right thing for you. Good job. A Medicare supplement plan, there's a lot to be said for the simplicity of knowing that everything you need to do is covered. So I don't think you should consider a Medicare Advantage plan, Marsha. I think you found the right thing for you. Now, there are a lot of people that can't afford that premium, and they have to take what's available to them and reduce costs on a monthly basis. I've worked with people that have chosen not to take medications that their doctor prescribed and said that they need to take for their health because they are buying cat food. So not everyone can afford it, right? So I applaud you. You found the right thing, and that's the right thing for a lot of people. Anita asked, we hear a lot about Chapter. What is it? Chapter is, if you're talking about Chapter, the insurance agency, they're an insurance agency, a call center that I know the founders of that company. We have worked together on some different things. They have a very similar idea about how to work with the public the way that we do. And their idea, which is a plan fit idea, is that we should help you look at everything that's available to you and help you enroll in the plan that you think is best for you and not be biased. So that's what Chapter is. They're an insurance agency like Plan Fit, and they do the same thing that we do. They help people to find the plan that's best for them. Would I say go to Chapter? Sure. Would I say to go to Plan Fit? Absolutely. Because with Plan Fit, I know that you're going to be well taken care of. I assume that you'll be well taken care of with Chapter as well. They are some of the good guys. So that's who Chapter is. Anita said Atrio is Nevada and Oregon. Can you address that? Atrio. So Atrio is a regional health plan. They have been in Nevada and Oregon. You know what, Anita? I haven't looked to see what their plans look like in 2026. So I wish I could give you more, but we will be researching them. In Northern Nevada, they were St. Mary's Health Plan. They had a very small number of enrollees because they didn't have the network, but in Oregon they were much larger, and they are one of the regional, more regional carriers. We have one more question about Medicare N. This will be my last question, then I'm just going to close up here. Medicare N is the Medicare Plan N. It's a Medicare supplement plan. So most people, when they choose a Medicare supplement, choose between one of two plans. They choose between a Plan G and they choose between a Plan N. Now, I would tell you that there's another plan that they should be looking at. Not that they should join, but they should at least be considering. And that's the high deductible Plan G. But most insurance agents won't tell you about that because it pays less commissions. But the Plan N is like a Plan G. It allows you to go to any doctor that takes original Medicare, which, by the way, is not all doctors, but any doctor that takes original Medicare, you can go with a Plan N. It has your Part B deductible of $257 that you have to pay. You have to pay a premium to have a Plan N. And then it also has a copay when you see your doctor or when you see a specialist. So it's like a Plan G with a copay. And one other really important thing, it doesn't cover excess charges. Some doctors can charge 15% more than Medicare. And some hospitals and facilities, think the premier facilities, if you're going to go to Loma Linda, I don't know that Loma Linda charges excess charges. I'm just giving you an example to say that higher tier groups sometimes charge excess charges, and your Medicare supplement plan N won't cover it, and you have to pay it. So that is a risk. So it's one of the things to consider. But the Plan N has some positive sides too. Fewer people choose the Plan N with with major health conditions. We went through a list of things that major health conditions and things that Marcia had talked about. Oftentimes people with a lot of major things happening, they will go with the Plan G because they know that they have the ultimate coverage. That also means that the Plan G tends to increase in rates faster than the Plan N. So with the Plan N, you're going to have a lower cost than a Plan G, but you have a little more risk. So that's one of those things where, if you want to have the least amount of risk, you got to put up the most money. It is one of the you get what you pay for things when it comes to Medicare supplements plans. So, okay, man, we've had a great discussion. We've had a lot of great questions. Man, I really appreciate all of the interaction here. I just want to say, there's probably, and I didn't go through everything. There's more questions that were on the live stream. If you have questions, you can call my team again, 877-360-6565. Tell them Calvin sent you. My team will be available to answer your questions. We kept them free for the next 30 minutes or so that they're not making other calls or returning calls right now. They're just available for you. And we do this because there are so many ways that you can make a mistake with Medicare. When it comes to Medicare, just 10 minutes of talking to someone who knows what they're doing can really save you a lot of pain and heartache. Now, if you want to switch plans or if you want to compare your options, that's what we're here to do. We will take you through a Medicare checklist step by step, looking at your medications, your doctors, making sure that you're confident that you'll have the plan that you need for your next upcoming year. And I can't stress this enough how important this is. And we had that question about another insurance agency chapter. This is really critical. I want you to know that our insurance agents, and this is one thing that sets Medicare, that sets PlanFit apart. Our insurance agents who work here, they do not get paid on commissions. They have salaries. They receive full benefits. They even have healthcare. We provide healthcare to them. And that sounds like that's just something you would expect. But you know what? Most insurance agents don't even have healthcare provided by their company. So they get paid a salary so that they are not going to push anything on you. They care about what's best for you. And that's very uncommon in this industry. So you can call right now. You can schedule an appointment. You can go to myplanfit.com. And if you want to make an appointment for later, you can actually schedule your own appointment on myplanfit.com as well. So thank you for taking the time for all of this year's big Medicare news. I know it seems overwhelming, but just take it one step at a time. Look at your specific situation, call or book with us, and we'll help you where we can. And we'll review your plan and help you as best we can. But thank you again for joining me. I'm so grateful that you took this time to discuss and look at these things with me. Share this with a friend if you see it online. Follow us online, and we'll just keep providing as much information as we can to help you to make the right choices in your Medicare. All right, guys. Thank you again. We'll talk to you soon. Bye-bye.